Have you been injured and told that you have a disc herniation and you don't know what to do next? Don't worry, you're not alone. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation. I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I have been managing patients with disc herniations for the last several decades. This is a common question that we see here and part of the reason why we made this video. I'm going to answer this question with a short 4-part series of videos. Now, I want you to remember this important disclaimer. These videos are not a substitute for professional medical advice, for professional chiropractic advice, diagnosis, or treatment. They're for informational purposes only and educational purposes only. So this series is 4 parts. The first part, we're going to discuss what is a normal disc. In part 2, we're going to discuss what is a herniated disc. In part 3, we are going to discuss common treatment from a chiropractic standpoint and from an integrated healthcare standpoint. And part 4 is going to discuss self-care and is going to discuss how long it usually takes to recover from a disc herniation. So with that, let's get started with part 1. All right, so now we've got a model right here that I will be going over in a moment, along with another very detailed model. So what is a normal and what is a healthy disc? This is really important to begin with, especially from a patient perspective, because whether you've thought about it this way or not, ultimately you want to know what normal is because that is your target. That is your endpoint. That is where you want to return to. So rather than looking at this as what is a normal disc, we want to look at what is a near normal disc. The reason being that sometimes when the body is injured, it never goes back to the way that it was before. That doesn't mean that you necessarily will always have symptoms and discomfort, but there's changes and there's ways that the body repairs with those changes. So first of all, in order to understand the spine, you really should take a look at the big picture, at the global picture. So I have a model over here of an entire large spine. So let me show it to you. So the spinal column is made up of a large series of bones that are held together with something that's called connective tissue. So whenever there is a disturbance in one part of the spine, there's usually a cascade of effects that go up and down. That's why it's important. Now, with a disc herniation, we need to know what the disc is. The disc, as pictured by this model here, are soft pieces of material that act as spacers, so to speak, between bones. Bones are very similar to what we have in our legs, what we have in our arms. So it's part of the skeleton. The whole spine is broken into several regions. You have the neck, the mid-back, and the lower back, along with the pelvis and the tailbone. Now, the medical terms for that is cervical spine. In the middle, you have the thoracic spine. That's anything with a rib attached to it. It's called thoracic. And in the low back, it's called lumbar. And the tailbone is called the sacrum. So these individual bones are all stacked together. And as doctors, we separate them, cervical, thoracic, and lumbar, for teaching purposes and for understanding. Now, the next thing that happens is that we have what's called a motion segment. A motion segment is where we have 2 bones that are separated by the individual disc. And this is vitally important because the spine acts as an incredible machine that has to be rigid enough to lift hundreds of pounds, yet flexible enough to bend over and pick up a pencil off the floor. It's a rather bit of surprising engineering, and it takes a lot to make that happen. The discs, which are the soft portion between the hard bones, they have a mechanical or biomechanical role. They act to transfer motion above and below. So these little bumps that you see on this motion segment right here, these bumps are what you feel when you run your hand on the back of your neck. That's called a spinous process. Those are muscle attachment points. Right here, you would have the joints on the back of the spine. They're very small. And then in front of it, you have the disc. Within the disc, this is looking at it from the top down, you have circular fibers and then a soft nucleus in the middle. So what happens is the outer fibers are called the annulus. The annulus is essentially like a steel-belted radial tire. If you remember some of those old tires from before. They act to constrain and restrain the soft nucleus in the middle. The nucleus in the middle disperses force. It has a bunch of different properties. And here's the other thing. the disc is alive. Not pictured on this model are nerve endings. There are nerve endings that go into a healthy disc, especially into the outer 1/3 of the annulus. So there is information that is coming from the disc that is going to the brain, whether you're aware of it or not. What ends up happening is this disc is alive. It has the ability to communicate symptoms. It has the ability to communicate mechanical properties like how much compression, how much shear, how much force is going through it. So the disc is alive. It's communicating information to the body in its entirety. And in a properly functioning disc, it allows bending and movement and allows rotation and can withstand a lot of forces. This is part of the reason why we can fall on our butt, and the compressive forces are distributed throughout. Now, not only that, in this model, I'm going to show you a little bit more. We have, show you right here, we have this yellow ligament right here. It's called ligamentum flavum. And then over here, we have a joint that is covered in yellow. Now, this joint is called a joint capsule. This one over here is an inflamed, injured one. So I use this model to show joint injuries and a few other things. But what ends up happening is you have to realize, oh, and this is a muscle right over here. All these motion segments have muscles that anchor to them. And it provides with the ability to move forward and backwards, bend forward, rotate, compress, lift. They all work together. It's very synchronized, and when it works marvelously well. So that is what is a healthy disc. Last but not least, I'm going to use this one again. When the weight of the human body is on the spine, it varies from the neck to the low back, but we'll just take the low back, for example. In the low back, the amount of weight distribution, approximately 80 to 90% is on the disc, and about 10 to 20% is on the joints in the back. That becomes very important when we understand a disc herniation and how it alters the motion segment, how it alters movement, and how it works to not only create pain, but sometimes perpetuate pain. That weight distribution across the motion segment can get altered. So there you have it. Thanks for taking time to listen to this video. I know that you have a lot of choices to listen to, and I'm honored that you chose mine. Remember, this is for educational purposes only, and nobody's spine looks like this. This is just a sample segment. But until next time, be blessed.